Well, recently, a cover article, Time Magazine, The Coming Epidemic of Arthritis. Also, you see all kinds of articles in the newspapers and magazines saying, and this is also in medical journals, we now have an epidemic of rickets. Rickets, simple vitamin D3 deficiency. What's going on here? Well, when you look at it, we're looking at osteopenia, osteoporosis, arthritis, said rickets, periodontal disease, which is osteoporosis of the skull, peripheral neuropathies, everything from Bell's palsy, trigeminal neuralgia, things like tinnitus, ringing in the ears, Meniere's disease, now aka Wallach's vertigo. These things are all peripheral neuropathies. Of course, sciatica, peripheral neuropathies, bone spurs, kidney stones, and spinal stenosis. Now, what's going on here? Well, I urge you to contact your Youngevity associate and get the books Dead Doctors Don't Lie, the CD, the DVD, Dead Doctors Don't Lie. Get a hold of the book Epigenetics, The Death of the Genetic Theory of Disease Transmission, the book Rare Earths Vin Cures, and, of course, the DVD, Somebody Needs to Go to Jail, and the CDs, Public Enemy Number One, and a stick of butter a day keeps the doctor away. Now, what's going on here is these are just simple nutritional deficiency diseases. All of these are simple nutritional deficiency diseases. They all affect the musculoskeletal system, and, of course, they are preventable. All of them are reversible. Of course, surgeons make their living by doing joint replacements, hips, knees, shoulders, fingers, neck, doing disc surgery, spinal stenosis surgery, all this kind of stuff, kidney stones, things like surgery to remove the larger stones, lithotripsy, all this stuff, when really very simple to supplement properly the 90 essential nutrients, 16 minerals, 16 vitamins, 12 amino acids, 3 fatty acids, and prevent these things. Well, my doctor says I can get everything I need from my food. Well, that's absolutely positively not true. And, of course, this all occurred when electricity came along because historically for thousands of years, wood ashes in the garden as fertilizer were also our traditional source of nutritional minerals. And when we went to electricity at 3 o'clock in the afternoon, Monday, September 4th, 1882, on Pearl Street, New York City, on the bluff overlooking the construction of Brooklyn Bridge, after 10 years, every town and city and municipality in the industrialized world had converted from wood as a universal fuel to electricity. We no longer had access to wood ashes, which were our traditional source of nutritional minerals. And suddenly now we're getting all these things in just really epidemic proportions. So I urge you, contact your Youngevity associate, get a hold of the book, the CD, the DVD, Dead Doctor Don't Lie, the book Epigenetics, The Death of the Genetic Theory of Disease Transmission, and the associated CDs and DVDs. The DVD, of course, is Somebody Needs to Go to Jail, and the CDs are Public Enemy Number One, and A Stick of Butter a Day Keeps the Doctor Away, and then, of course, Rare Earths Vin Cures. Learn how to deal with this. We need our bodies, our DNA, our genes, RNA, and telomeres every day, every second of every day for our life requires raw materials. Okay, you can be the best carpenter in the world, and if you don't have wood and tools and nails and screws and bolts and nuts and roofing materials and glass and so forth, flooring material, right? You're not going to be able to build a house, no matter how good a carpenter you are. Same way with your genes. You can have great genes, but if you don't have the raw materials, you can't do that. So I urge you to contact your Youngevity associate. Say, look, I need those 90 essential nutrients. I want to prevent this stuff. I put oil in my car to prevent my car from burning up. I don't wait until the car burns up, put oil in. I want to do the same thing for myself. So you need the 90 essential nutrients, 16 minerals, 16 vitamins, 12 amino acids, 3 fatty acids. You need these things every minute, every second, of every hour, of every day, of every week, of every month, of every year for the rest of your life. Okay, well, my doctor says. Well, your doctor's not telling the truth. So I urge you, again, to learn how to deal with this yourself. Don't wait until you get some horrible, horrible thing. You go to the doctor and say, oh, my gosh. Even in Harvard Medical School, the Department of Orthopedic Surgery came out in July of 2002 in the New England Journal of Medicine. They looked at the records. They didn't look at the individual patients, but they looked at the records of 300,000 people who in the previous year had gotten double knee replacements. They said, surgery for arthritis is worthless. That's the orthopedic surgeons at Harvard Medical School in July of 2000. And looking at the records of 300,000 people who had received joint replacement surgeries for bone to bone arthritis in the knees, they said that surgery for arthritis is worthless. Now, that was July 2002. I've been saying that since the 1960s. And I urge you, again, to pay attention to this. It will save you an enormous amount of unnecessary misery. It will save you an enormous amount of money. It will save you the possibility of death, injury, disability, amputations, because of all the mistakes and bad things that go along with, with surgery. There's a certain percentage of errors that go along with this stuff, right? And 251,000 people are killed each year just by simple mistakes during surgery. 251,000 people are killed each year. That's from Johns Hopkins School of Medicine, not me. 251,000 are killed in hospitals each year by doctors making simple mistakes. Okay, why would you subject yourself to that when for just a few pennies a day you can prevent these things? And if you have them, it might take a little bit extra, might take you $3 or $4 or $5 a day, depending on your body weight, right, to give your body the raw materials it needs to support and promote maintenance repair. And I'd go for the maintenance repair, but better yet, I would go for the prevention. Contact your Youngevity associate today. Get the books, CDs and DVDs, Dead Doctors Don't Lie, Epigenetics and Rare Earth-Bin Cures. And stick with us. We'll be back with more Truth, Justice, and the Youngevity Way on Dead Doctors Don't Lie after these messages. Okay, Doug, let's go to Pearls of Wisdom.
All right. This is a good example, this particular story that I got from Natural News, of that it is possible to deal with health challenges without using drugs. And in this study from Australia, they say that Manuka honey kills more bacteria than all available antibiotics. They say for a long time, they've known the benefits of unprocessed honey. It's been well documented over the centuries. Australian researchers have found one type of honey called Manuka honey that is better than all the known antibiotics at killing bugs. They say the Manuka honey is produced by bees that forage in the nectar of the New Zealand's Manuka bush, as well as tea trees native to Australia and New Zealand only. And they say this remarkable type of honey not only effectively kills bacteria, but none of the bugs killed have been able to build up an immunity. And in this world where we have a lot of last resort antibiotics failing against antibiotic-resistant superbugs, Manuka may hold the key to fighting resistant issues and saving thousands of lives worldwide. According to Dr. D. Carter, the University of Sydney School of Molecular Biosciences noted that antibiotics not only have short shelf lives, but the bacteria they attack quickly become resistant. This was all published in the European Journal of Clinical Microbiology and Infectious Diseases, and claimed that Manuka honey killed almost every type of bacteria and pathogen it was tested on. None of the bugs tested were able to survive the honey treatment. According to Dr. Carter, there are particular compounds like methyl glyoxal in the Manuka honey that cause multi-system failure in the bacteria, killing them before they're able to build up an immunity. Manuka's biological properties range from antioxidant, anti-inflammatory, antibacterial, antiviral, antibiotic, and wound healing to immune stimulatory. It separates Manuka honey from the rest. That is, that its antibacterial powers challenge even the toughest bugs, such as life-threatening MRSA. So there you go, Doc. Just a natural way that you can treat, wounds that don't heal very easily with something that's not going to cause you to have other problems like killing off all the good bacteria in your system.
Absolutely, and of course, this is where that book, Passport Aromatherapy, comes in, because it talks about the Manuka plants in Australia and New Zealand. And of course, we have these things in our aromatherapy division in Youngevity called Ancient Legacy, of course. And this is as the article points out, we're talking tea tree oil and also eucalyptus. I like to use the eucalyptus globulus and the tea tree oil. When I go on airplanes, everybody's hacking and coughing and sneezing and everything. I carry a little bottle around my neck with these oils in there to protect myself. And so far, it's been good for 60 years. I haven't had a cold, haven't been sick, haven't gotten the flu, certainly haven't gotten MRSA, haven't gotten any of these things. And so I can second that. And so I urge everybody again, based on this article you've thrown out here, to get a hold of that trilogy books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport Aromatherapy, and particularly Passport Aromatherapy, and look at our aromatherapy division and deal with the immune system. We have immune support in the good herbs. Again, the same source of these oils. I just have been so excited about these things. I learned about them at first when I was in the naturopathic college getting my degree as a naturopathic physician back in 1978. I had never heard of such a thing. And so I know that Grandma used to give us honey when you have a sore throat and that kind of thing as a kid. Didn't know why, but by golly, it works. So thank you so much. And again, I urge everybody to get a hold of that trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport Aromatherapy. Let's go to work, save our families, save our church mates, neighbors, workmates, and we'll save America as a result. We'll be back with Dead Doctors Don't Lie after these messages. Okay, Doug, let's go to callers.
All right, let's head to Wisconsin. And Harold, you're on with Dr. Wallach.
Well, Harold, you're on the air.
Well, good afternoon, Dr. Wallach. It's a pleasure to be on the phone with you.
Well, thank you, sir. How can we help you?
My wife. I'm really calling on behalf of my wife. We're both 64. She's 5'1.5", 200 pounds. So obviously she's overweight. She had a stroke 4 years ago, but she's recovered primarily from that, almost 100%, but not quite. We've been on the products now for about 90 days, and we seem to have plateaued. We're not seeming to gain, or lose the weight that we should be. We've been on ASAP, and now we're switched to the other one, Rev.
Mm-hmm.
And we're on the Healthy Brain and Heart Pack. We're on a variety of other additional things, Sweeties.
Well, let's stop there for a minute. Okay, so if you're on Sweeties, she must have diabetes. Is that correct?
Right. She was diagnosed with that, but she's off of insulin and all of the drugs associated with that.
Okay, good. And then what about high blood pressure?
She's running roughly 140/83.
I mean, is she on medication?
Well, no, she's not on medication. We've kind of, weaned herself off. So.
Okay, good. And let's see here. Any skin or problems, eczema, dermatitis, psoriasis?
Yeah. She has a little bit of like rash on her face or
rosacea, it's called. Yeah, rosacea. Okay. And then any respiratory stuff, asthma, bronchitis?
No, that's been, we haven't had any issues with that, no.
Okay. All right. Any bowel problems, constipation, diarrhea, irritable bowel syndrome, ulcerative colitis, Crohn's disease, anything like that, appendicitis?
No. She had her gallbladder out, though, quite a few years ago, and she had a hernia operation.
Sure. Okay. Charmaine, this is a Char thing. Here's a lady, 5'1", about your size, 200 pounds. I'd say maybe anywhere from 90 to 100 pounds overweight, depending on her build. And she has a little bit of a history of some blood pressure, a little bit of a history of some diabetes, and she has had a stroke. She does have rosacea on her face. And so what do you think's going on here?
I know. She has a gluten intolerance. There's no question about it.
Okay, and so what kind of diet would you put her on?
A gluten-free diet. No wheat, barley, rye, or oats. And, of course, the other stuff, too. No fried foods, no
processed meats, no oils?
Right.
Okay. Okay, so hang on here, Harold. We'll come back, and Char and I will give you a program which is going to sort of support whatever you're doing, because obviously you're getting some progress. But let's really make things happen here for your wife. We'll be back after these messages. Okay, Doug, let's go right back to Wisconsin and Harold. Okay, just a quick review, Harold. Remember, Char said absolutely no fried foods for your wife and yourself, absolutely no processed meats with nitrates and nitrites. That means deli slices, sandwich meat, sausage, ham, bacon, bologna, salami, pastrami, pepperoni, jerky, corned beef, Spam, chorizo, all those kind of things got to go. No oils, no microwave popcorn, theater popcorn, absolutely no olive oil, coconut oil, margarines, mayonnaise, salads, and cooking oils. And no gluten, no wheat, brown, rye, and oats. That means also in the dog food, cat food, bird food, fish food, yourself, grandma, mother-in-law, renters, kids. Everybody's got to be drop-dead gluten-free here. This has been passed on to your children you've had with your wife, right? And then just doing that's going to help lose the weight. And of course, wouldn't hurt to get an extra bottle of the Rev. Although, what would you give Harold's wife as a nutritional program? She's already doing well, but let's see if we can make it better. So let's just start from scratch. What would you have Harold's wife take at 200 pounds to lose that 90 to 100 pounds? And the 90. How would you get it to her?
You mean food-wise, diet?
No. We already did the diet, but what would you do for a supplement program?
For a supplement, well, I'd get her on 2 healthy brain and heart packs myself.
Okay.
And then, of course, the Rev. And
I'd get her 2 bottles of Rev so she could take a dropper full under her tongue 30 minutes for each meal, and a second dropper full 15 minutes for each meal. Kind of ramp up a little bit on that, and leave it absorbed through her oral tissues. Don't let her swallow it. It won't hurt if she swallows it, but she won't get maximum benefit. And then, 2 healthy brain and heart packs. So how many sweeties would you see that she should take?
She should probably take at least 2 before each meal, so 6 a day at least.
Yeah, I'd go with 9, okay? And let's get her to where she's really, really getting that blood sugar down below 100. And what would you do for the blood pressure? She's right on that cusp. She's like 130-something over 84, 85, just slightly high in both the upper number, the lower number. And so what would you do for blood pressure here?
She could take the Ultimate Daily Classic, the Niacin Plus, and the Cardio Sticks. Okay,
yep. At 200 pounds, I'd have her take 3 of the Ultimate Classic. Let's see here. The Ultimate Daily Classic, I'd have her take 3 of those 3 times a day. It'd be 3 bottles a month. I'd kind of go heavy here so we can really get this under control. Once you get it down under control, where she's like 117, 120, over 70-something, you could cut it down to 3 twice a day. Let's go with 9. That's 3 bottles a month. The Ultimate Niacin Plus, 2 of those twice a day, 2 bottles a month. Ultimate Cardio Sticks, 2 boxes a month, 2 of those sticks a day. And then give us a call every couple of weeks. Let us know the blood pressure, the blood sugar, the weight, and we'll walk you guys through this. We'll be back with Dead Doctors Don't Lie after these messages.
Let's head to Chicago, Illinois, and Tom, you're on with Dr. Wallach.
Tom, you're on the air.
Good afternoon, Dr. Wallach.
Yes, sir. How can we help you?
I got a few questions on Dupuytren's disease. The first one is, how does someone get it?
Okay, this is where the wrist is bent forward and doesn't straighten out real well.
It's where the fingers come in from the cords.
Mm-hmm. Okay. Well, that could be the fingers. It could be the wrist. It can also be called trigger finger, particularly if the index finger doesn't straighten out. You get hammer toes, and you get the same thing in the toes. And it's caused by a shrinking of the tendons, okay? You're not getting the right raw materials in the diet, either because it's not in your food and or you might not be absorbing it. Is this yourself or somebody else?
It's myself, but I was told it was the collagen 3 that's building up. That's the cords.
Okay, well, here's the problem. Whoever told you that is ignorant. Okay, they're telling you the result of what's going on. They're not telling you the cause of what's going on. Okay? You want the cause because we've got to deal with the cause and give your body what it needs to maintain and repair itself. So, what do you weigh, sir?
Okay. 175.
And how tall are you?
5'9".
Okay, about right. And do you have any history of any skin problems, any eczema, dermatitis, psoriasis, rosacea?
No, sir.
Okay, great. Do you have any history of any respiratory problems, any asthma, bronchitis as a kid or young adult?
No.
Okay, good. What about bowel problems, constipation, diarrhea, those kind of things, irritable bowel syndrome, appendicitis?
A little bit of bowel syndrome.
Okay. All right. Do you have any brothers and sisters?
Yes.
Okay. Do they have any bowel problems or skin problems or asthma?
No.
Okay. Let's see here. Okay. That'll cover that. Okay. Charmaine, what do you think's going on with Tom here? He's got some bowel problems.
Bowel problems may or may not have anything to do with gluten, though.
Mm-hmm. Could.
It could, but it could maybe not too.
Mm-hmm.
So
okay. Well, let's maximize things here and assume it is. We'll save him some money, get him off of gluten. Okay. So that's where we're going. No fried foods, no processed meats. Yeah. Get rid of the inflammation. No oils. No. Absolutely no olive oil, coconut oil, margarines, mayonnaise, cooking oils. No gluten. No wheat, barley, round oats. If you're going to drink beer, Tom, you got to drink the gluten-free beer, things like Red Bridge from Anheuser-Busch and so forth. Again, our Go foods are gluten-free. are beyond organics or gluten-free, and so I urge you to kind of look at those things. And so what would you do for this chronic tendon thing? This is a musculoskeletal problem, Char. What would you do for him?
Well, I'd get him on two healthy brain and heart packs, and then I would add the glucogel to it.
Okay, very good. Absolutely, I would. Char's exactly right there. In addition to the dietary changes, I'd go ahead and take 2 healthy brain and heart packs per month. It's a full dose of everything at breakfast and again at dinner time. It contains the raw materials to support maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between a vertebrae, bone makes bone itself, as well as these flexor tendons in your hands and your wrist, and also your feet and so forth, because it's all going to come to the same thing if you don't deal with it. And then, what would you do topically? What would you have? What would you have Tom put on the palms of his hands and his fingers, his wrist, any place else as this is going on? What would you have him put on there topically?
The CM cream with the Trauma oil in
Very
it.
good, very good. Now get yourself a couple of bottles of CM cream, as Char says, and get a couple of these 10 ml bottles of the Trauma oil, Trauma, Trauma oil from our Ancient Legacy division. It's a blend of oils. It actually can give you some analgesia or pain relief, anti-inflammatory stuff. 5 or 6 drops of the Trauma oil per teaspoon of the CM cream. You might need 3 teaspoons per hand if your hands are big. And this affects more than your index finger, which would be called trigger finger. It could be in the wrist or your fingers only, or fingers and wrist. So wherever you need to have this, so you may have to go through 3 or 4 teaspoons a day, which would be 15, 20 drops of the Trauma oil. So you go through a couple of bottles of each per month. And I'd kind of go that direction. It's not an autoimmune disease. It's a very simple nutritional deficiency, easily dealt with. You can give yourself a little bit of physical therapy. Put your fingers on a flat surface like a table, and just very gently try and straighten out your fingers, like 2 or 3%. Don't work real hard on them. And you'll notice that over time, over a period of weeks, maybe even days, certainly weeks, 60, 90 days, you're going to see a major improvement, because when you give your body the raw materials, your genes, DNA, RNA, and telomeres want to repair themselves and maintain themselves, but they need raw materials to do it. Give us a call every couple of weeks, bring us up to date, and we'll walk you through this. Pretty straightforward. Okay, Doug, let's go to callers.
Let's head to Spokane, Washington, and Michael, you're on with Dr. Wallach.
Hello, Michael, you're on the air.
Yes, sir. I appreciate your ministry there.
Well, thank you. God bless you. And how can we help you?
Yeah, my wife was diagnosed with Raynaud's. I think I'm pronouncing it Raynaud's disease.
Okay.
She had discoloring in her fingers about a year ago.
Mm-hmm.
But last week her nose went numb.
Mm-hmm.
And so she went into a clinic, and the doctor said that she probably has Raynaud's disease, and it could be something worse.
Mm-hmm.
So now she's seeing her doctor today. So I'd like to know what your nutritional protocol would be for my wife.
Okay, well, yeah, but one of the things I'm sure they're going to look at, especially with that numbness in her nose, they would maybe do an ultrasound or a CAT scan of her head to see if she's got anything having to do with MS, multiple sclerosis, make sure that's not going on. Also could be a peripheral neuropathy. How old is your wife?
64.
Okay. And does she have any history of arthritis or osteoporosis?
No, not that I know of. No.
Okay, no.
She's complained about stiffness in her neck.
Okay, stiffness in the neck. That could be osteoporosis or degenerative disc disease. That's possible. Also, how tall is your wife?
About 5'5".
Okay. Did she shrink any that you know of in height?
I don't know. No,
okay.
I don't know.
I need to measure and see if she hasn't shrunk a half inch or so. Does she have any dental problems, receding gums, gingivitis, periodontal disease, bridges, plates?
No, I don't think so.
Okay, so she has all her own teeth and no problems with dental problems?
Yeah, she has her own teeth.
Okay. Yeah. Well, these sorts of things can also be caused by a osteoporosis of the skull and peripheral neuropathy. There's 12 pairs of cranial nerves. The nerve starts in the brain, comes out 12, come out on the left side, 12 on the right side. When you get osteoporosis of the skull, the tunnels that these nerves come through get filled with connective tissue, and they tend to squeeze those nerves. And so that is all kinds of things that need to be looked at. And how much does your wife weigh?
Boy, I don't know. She's not very heavy.
Okay, we'll be back after these messages. We'll be right back with you, Michael, after these messages. Back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Young Judy, 95 Crusade. And Douglas, right back to Washington State. And Michael, well, very quickly, Raynaud's disease is actually a cardiovascular problem. It's a PAD, it's called peripheral artery disease, where all the little small arteries in the fingers are plugged. The small arteries plug faster than the big ones. And when you pick up a cold glass or go out in the cold, these arteries will just clamp down and shut off the blood supply, and so again you get a blanching. You lose color in the skin of the fingers, and of course that can happen in the face too if you have the same thing going on in the small blood vessels in the nose and the cheeks and the face and the tongue and so on. And so what I would do, let's say your wife only weighs 120 pounds, Michael, since she's small and she's 5'5", let's say 120 pounds, I'd give her one healthy brain and heart pack per month, divide it in half. I'd go ahead and give her a full half a dose of everything twice a day. I would also give her 2 bottles a month of the Ultimate Daily Classic tablets, so she could take 6 a day, 2 at breakfast, 2 at lunch, 2 at dinner. That's to support healthy blood flow through obstructed arteries, support healthy blood pressure. She also should get the CM cream and apply that to her fingers and her neck and her face. And let's find out, when the doctors talk about the diagnostics they've done, get more information, call us in 2 weeks and 4 weeks and 6 weeks, or anytime you get the information from the doctor, and we'll know if there's anything more serious going on. Okay, Doug, let's go to callers.
All right, let's head to Boulder Creek, California. And Andrew, you're on with Dr. Wallach.
Okay, Andrew, we only have a few moments, so we have to get to it, sir. How can we help you?
Okay, very serious things. My girlfriend has an ovarian cyst, possibly polycystic ovarian syndrome. She takes Tangy Tangerine, Osteo. She's gluten-free, she's oil-free, and more.
Okay.
What do we do or take about that?
Okay, so she as the 90 essential nutrients, she needs, of course, the Beyond Tangerine. She needs the Osteo and the EFA pluses, right? That's going to give her all 90 essential nutrients. And Char, what would you give her for girly stuff like polycystic ovaries and dysmenorrhea and PMS and all that kind of stuff? What would you give her?
I give her the Women's FX and the Xerafem.
Okay, you get an A++, girl. Yep, the Women's FX. What does your girlfriend weigh?
120.
120, okay. Then I'd give her 1 ounce a day of the Woman's FX. I'd go ahead and give her a half ounce, which is a tablespoon of breakfast and dinner. It'd be 1 quart per month. And the Xerafem, Xerafem, as Char says, I'd go ahead and give her 2 of those tablets twice a day. It'll be 2 bottles a month. And make sure, what food would you give her to make sure that she can make enough hormones, Char?
Eggs.
Eggs, you bet. Let's say she weighs 120 pounds. I'd go ahead and give her, say, 6 to 8 eggs a day. And what diet would you put her on?
Well, a gluten-free diet, of course.
Gluten-free diet, so she can absorb the cholesterol, which is the raw materials for her ovaries to make estrogen, progesterone, and so forth. So she needs to be no fried foods, no processed meats, no oils, no gluten, no wheat, brown, rye, and oats, maximize absorption of everything. And then call us in 2 weeks and 4 weeks and 6 weeks, and we'll walk you guys through this. But I think Char gets A++ on this one, and we'll be able to hear a good testimony in 2 weeks and 4 weeks. We do this, and we see this all the time. Very common problem. Don't forget the eggs. It's the raw material for the ovaries to make progesterone and estrogen, and the adrenal glands to make the adrenal hormones. And for guys, don't forget the eggs, guys. You can go up to 25 eggs a day. It was published in the New England Journal of Medicine. The New England Journal of Medicine was published, right? And so 25 eggs a day. And guess what? You won't need Viagra, because you'll be able to make your own hormones. What a concept. Okay, how much time we have here, Doug?
Got about 45 seconds.
45 seconds. Well, I'm going to go ahead and take it. Remind everybody, get a hold of that book, CD, DVD, Dead Doctors Don't Lie. Get a hold of the book, Immortality. Get a hold of the book, Rare Earths and Cures, and learn how to add 25 to 50 healthy years to your life. Don't forget, this is a great thing for you, but even more importantly, maybe it'll add 25 to 50 healthy years to the life of your kids, your grandkids, your brothers and sisters, your nieces and nephews. Have family meetings every week. This is a serious thing. Don't just say, well, I talked to them and they weren't interested. Have family meetings every week for 30 minutes on this subject. This adds 25 to 50 healthy years to your life. Is it not worth 30 minutes a week? Absolutely. Contact your family. Make sure everybody's involved. Give Youngevity products for birthdays and holidays. Anytime there's a present due, don't forget Youngevity presents. Okay. Thank you so much, everybody. Thank you, Char. Super job as usual. Thank you so much, Doug and Sam. Super job today. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.